Hey everyone, for our community right here in Australia following Dr. Sachin Kodistane, we're going to tackle a topic that affects so many of us, but is often kind of surrounded by silence and a lot of misunderstanding. We're talking about pelvic floor dysfunction. Let's dive right in.
So let's just kick things off with a massive question. If you've ever dealt with bladder leaks or maybe some kind of pelvic pain, have you ever caught yourself thinking, well, I guess this is just my life now? It's an incredibly common thought, but I'm here to tell you, and this is a huge relief for so many people, the answer is a big, resounding no. You absolutely do not have to just live with it.
Okay, so to really get why these things aren't just something you have to put up with, we first need to be super clear on what we're actually talking about. The term is pelvic floor dysfunction, or PFD. And honestly, the best way to think about it is as an umbrella term, one name that covers a whole range of related issues. And here is the absolute key. PFD isn't a disease, not in the way we usually think about it. It just means that group of muscles down there that supports all your pelvic organs, your pelvic floor, it isn't working quite right. It's a functional problem. And that's what can lead to all these different symptoms, whether they're related to your bladder, your bowel, or just pain. So you might be sitting there wondering, okay, but how does this even happen? Where does it come from? Well, it's way more common than you'd think. And the causes are often tied to major life events or even just ongoing habits that put a bit of stress on that part of your body.
You know, when you look at a lifetime, you can see how different things can be triggers. It can be something like long-term straining from constipation. Then, of course, for so many women, pregnancy and childbirth are huge events for the pelvic floor. As we get older, hormonal changes during menopause can be another big factor. You also have to think about things like past surgeries. And you know what? Sometimes there just isn't one obvious cause. Doctors call this idiopathic, which is really just a way of saying the exact reason isn't known.
All right, so we've talked about what PFD is and what might cause it, but the big question is, how would you actually know if you're dealing with it? Let's get into the symptoms. And to make it easier, we're going to break them down into three main groups.
I think it's helpful to picture it like this. Your body is trying to send you signals that something's off. And with PFD, those signals usually pop up in one of three areas: your bladder, your bowel, or just a general sense of pain. So let's look at each one. First up, the bladder. This is the one most people are familiar with. Does this sound like you? Maybe a little bit of leakage when you cough or sneeze or jump around? What about that sudden urgent feeling of, I have to go right now? Or maybe you've just noticed you're heading to the loo way more often than you used to. These are all classic signs.
Okay, next, let's chat about the bowel. And what's really interesting here is that PFD can cause totally opposite problems. For some people, it might mean things are a bit looser. But for others, it can actually cause constipation, making it really difficult to go, which then leads to straining. And that can just make the whole cycle worse. And that third group is pain. We're not talking about one single spot here. It can be a more general pain or ache anywhere around your hips and pelvis. It can also be tied to other things like hemorrhoids or anal fissures, which are often caused or at least made worse by these exact pelvic floor issues.
And now we're at the most important part, the good news. What can you actually do about all this? Well, PFD is highly treatable. But, and this is a big but, the absolute key is knowing that the treatment has to be a personalized path just for you. The very first, most critical step is getting a proper diagnosis. This isn't about guessing or trying some exercises you saw online. It means seeing a professional, usually a physiotherapist, who specializes in pelvic health. They can do a full exam to figure out exactly what your pelvic floor is doing or not doing. Okay, this right here, this is maybe the single most important thing to get your head around when it comes to PFD. It's not always about weakness. So many of us automatically think we need to do strengthening exercises, right? But for a lot of people, the problem is the complete opposite. Their muscles are too tight, too tense, they can't fully relax, and the treatment for that is totally different. It's about learning how to release and down-train those muscles. This is exactly why you need that professional diagnosis. You've got to know which side of the coin you're on. Now, you might hear this term biofeedback thrown around. And I know it can sound a bit technical, maybe like you're going to be hooked up to some complicated machine, but it's really important to know that modern biofeedback is so much more than that. It's a really comprehensive approach. A good modern treatment plan is the whole shebang. It's totally holistic, and it's all about you.
It starts with education, so you actually understand what's happening in your own body. It'll look at your diet, your lifestyle, even emotional stress. Then you get the right exercises for you, whether that's strengthening or relaxing, and sometimes that's supported with medications or other tools. It's a full 360-degree plan to get you back on track.
So, as we start to wrap this up, I really want to focus on the one single message that you should take away from all of this. It's a simple little phrase, but it can be so incredibly powerful if you've been struggling. Just let that sink in for a second. Just because something is common, just because a lot of your friends might be experiencing it, that does not make it normal. It's not something you just have to accept as part of getting older or having kids. Leaking, pain, urgency, these are signals from your body that something needs attention. And here it is, the number one takeaway. Pelvic floor dysfunction is a completely treatable condition. With the right diagnosis and the right plan for you, you can get better. You do not have to just live with this. Your path to recovery starts with one simple action: having a conversation. If any of this has sounded familiar to you today, please talk to someone. It could be your GP, a pelvic health physio, or a specialist like Dr. Stain. Taking that first step is honestly the most powerful thing you can do to get the help that you deserve.